Members, we already have a quorum. I announce that the meeting is now officially commenced. Please pay attention when you speak. Please turn on the camera on Zoom to show your face. Your microphone will only be unmuted under my instruction. During the meeting, you can choose from 3 different backdrop colors. If you would like to submit any documents, please send to our panel@leshco.gov.hk address. Concerning our agenda, we are mainly going to talk about anti-epidemic measures in the school sector, because this is a critical time during the epidemic, and this is a very important matter. The Education Bureau would like to update members on the relevant measures. Now, please refer to CB bracket 4/228/2022 bracket 1 so that we can enter today's discussion item, anti-epidemic measures in school sector. Is the Bureau ready? Secretariat? Yes. In order to allow members to speak in an orderly manner, please remove all the hands raised. For those who have the intention to speak, please press the raise hand function on Zoom. After the secretary has briefed us on the paper, I will invite you to speak one by one. Now, Secretary for Education, Mr. Kelvin Yeung, please take us through the paper, please. Thank you, Madam Chair. Dear members, 2019 coronavirus has affected different walks of life, different professions in Hong Kong. In order to fight the spread of COVID, we have adopted different measures, and the Bureau has been following the development very closely to collect expert views and stay close communication with schools in order to launch different anti-epidemic measures to protect our students. We have also, in a timely manner, adjusted lessons arrangements. We have postponed the face-to-face mode and also had half-day schooling. Today, we are going to take you through certain anti-epidemic measures and lesson arrangements. We would like to thank the sector for doing very well the prevention of COVID measures, including arranging vaccinations for the students. Facing the dire wave 5 of the pandemic, we have adopted the following measures. First of all, the vaccination arrangement. Facing the serious wave of the pandemic, vaccination is the most effective method to prevent serious cases of death. We provide convenient and diversified ways to get vaccinated so that we can complete the exercise for students as soon as possible. We can have group booking arrangements so that they can go to communication vaccination centers. We also have mobile vaccination stations. And we also have outreach doctors going to schools to vaccinate students. We will step up such arrangements and requirements to further protect teaching staff, students, and boarding students, including those students at boarding schools and also those in special schools. By the 15th of May, they need to complete the first vaccination. And they also need to complete at least 2 vaccinations in total. Things are slowing down in relation to the epidemic, but it is no time to be complacent. We will continue to arrange vaccinations for students and their parents to protect community health and prepare our way to get back to face-to-face lessons and offer better protection to the entire city. The second measure is about the vaccination path. On the 24th of February, it's already been implemented. all teaching staff and people providing services on campus and visitors will have to get vaccinated for the first time, at least, to enter the premises. For those directly engaged by the schools, by 11th of April, they have to be vaccinated twice, at least. And towards the end of May, after the second vaccination within 5 months, they need the third vaccination as well. According to the health guidelines under the Bureau and also the health guidelines from the CPH, it stipulates that for health preventive measures to be carried out in schools, the Bureau is closely liaising with different departments to amend the content to cater for the needs under the fifth wave, and also considering the vaccination progress of students so that we can provide clearer guidelines to the schools that are catering to their needs. And we will make timely announcement before face-to-face lessons resume. We also provide additional support, including for all the students in primary and secondary schools. They have a subsidy so that schools can purchase all the pandemic fighting devices and materials. Masks have also been given to students. We have, under several rounds of AEF support, we have provided support to all the people working in relation to the school sector. We have also provided diversified online resources. We have set up a hotline and also mobile seminars to continuously provide support to the teachers in need. We also have different measures to support grassroots students to do e-learning. The Bureau also attaches great importance to healthy growth of our students. Since the outbreak of the pandemic, we have continuously provided timely and suitable emotional support to the students. We continue to diversify information disseminated online to teachers and parents so that we can pay close attention to emotional health and mental health of our students. Looking at the latest trend, all the schools in Hong Kong should be able to follow the original timetable, that is to resume face-to-face lessons after the Easter holiday in a timely and phased manner. First of all, for primary schools and international schools and kindergartens, they will resume their face-to-face lessons first. As for secondary schools, they can wait for the completion of the Hong Kong PSE. Such resumption exercise will be limited to half day to reduce the infection risk. From the angle of education, of course, we want to resume whole day schooling as soon as possible, but we will only allow those schools with staff members and students with better vaccination rates. We will further consider very carefully some recent concerns over resumption of lessons at different levels. We have looked at different measures to come to the most appropriate measure. For vaccinated students, for the other half day, they can carry out extracurricular activities such as musical or sport-related activities. We will make necessary announcements in due course. All these represent a very brief introduction to the measures, and we're happy to take your questions. First, thank you, Mr. Yeo. I will read the list of members waiting to speak. I hope to allocate 4 minutes to each member. Mr. James Tan, 孫東、朱國強、周文廣、梁希、梁玉偉、陳仲尼、卓海欣、梁柱永、陸向曼、透北、張國軍、郭玲麗, and myself, and then take 4 minutes each, question and answer. Mr. Tan. Thank you, Madam Chair. Mr. Young, we're talking about schools' preventive measures. I think what attracts a lot of concern is about the resumption of lessons in April and the actual arrangements. Looking at the paper and what you just said, before the Easter holidays, we'll make the announcements and the students' health guidelines, but that there will be an announcement on the amended version before resumption of lessons. The last update was the end of November last year. So that means totally no update since the outbreak of the fifth wave. We only have 2 weeks before resumption of lessons. Schools, students and parents need to know about the details so that they can be better prepared. For example, schools will have to do disinfection, they have to prepare for the resources and materials. Now you're not announcing, and we have to wait until before the Easter holiday. So you're giving them a few days of public holidays, it's enough for preparation. So what is the progress at the moment? Do you have specific dates for the announcement? I don't understand why we have to wait until the Easter holiday. Why can't we announce the details today or tomorrow? Mr. Young. Madam Chair, the specific arrangements, we are mainly talking about resumption date. And we are talking about whole day, half day schooling, under what circumstances, what we do. As for other preparations, including disinfecting the campus and preparing for pandemic preventive measures, there's no need to say, we all know about this. Before we resume our lessons, we must have large scale disinfection. We need to prepare thermometers and also rinsing gel, so on and so forth. We also need to talk to the CPH because in the recent period, the school sector has been talking about the phenomena from previous waves. Sometimes there were school-based infection cases. CPH will ask the school to suspend classes for a number of days to do large-scale disinfection, and then they will decide which students will be classified as close contacts, whether they need to be quarantined or not. So the first 4 waves are different compared to the recent round. We are still looking at a very high number of infections. Do we do the same? We are taking some time to talk to CPH and health experts who would like to use some measures to try to be as safe as possible and at the same time not affect the schooling schedule. In the past, one case means suspension for everyone, and students sitting near the infected students will be classified as close contacts. Are we to adopt the same arrangement? I think this time in our guidelines, there will be some major amendment. This is to respond to the demands of the school sector. And we also need to discuss in great details with the health experts. For example, we're going to offer more frequent rapid tests and use the results in a more rationalized way so as to make the environment safer and give us more room to do more. We need to talk to the experts on all of these matters. That's exactly why the fifth wave is different. You said a lot, and many parents have asked you, when will school be suspended? What happened to the students? Can you make the decision sooner? Is it possible? Well, we have to go through the details. If we don't, it will be more chaotic. But of course, we're talking about things after resumption, not just preparation beforehand. So there should be enough time for the schools. In the next 2 days, we will talk to schools further. Next, Thank you for coming to meet with us, and thank you for your efforts in fighting the pandemic. I want to ask some questions about vaccination. I'm glad to hear that before 24th of April, 2 vaccinations have to be completed, and then the third one should be completed in the next 5 months. So for those who are not being vaccinated, how are you going to deal with them? Those between 12 and 19, vaccination rate is 96%, which is true. But I think we need to launch a second round because they are just like adults. We need to set the indicators for the second.
The third point is that I'm very concerned about the 3 to 11-year-old students who account for 60%. I think the Education Bureau should put in place some more stringent requirements. Now, actually, starting September, I hope that there should be higher vaccination rates, at least for the first dose. So I believe there is the need for more detailed and more urgent vaccination requirements. I am happy to hear that concerning half-day and whole-day schooling arrangements, so basically for primary schools and kindergartens, half-day mainly, this is very good because there are still a lot of uncertainties. And in the new school year, more consideration should be given to half-day versus whole-day arrangement because there is the lunch break, and that may lead to more infection. And then concerning RAT, right now, I think the Bureau should consider after schooling begins, then in schools, there should be RATs, for example, once every week or some targeted sampling. So if there is problem, then solution can be implemented as soon as possible. That's all from me. Okay, Secretary. Yes, concerning vaccination, for teachers, we hope that by 21st April, they will have received 2 doses. And after 31st May, they should follow their own timetable because between dose 2 and dose 3, there is a time requirement. And according to that schedule, they should get the 3rd dose. In case if there are teachers who can't get vaccination, they should not go back to schools. If the schools require them to conduct lessons in school and they can't attend schools, then they are treated as absent. And so the schools will have some procedures, established procedures to handle teachers who are not able to conduct classes according to schools' requirements. For students, for those between 12 to 19 years old, the vaccination rate for the 2nd dose is almost 80%. So we will continue to work hard. So for students 3 years old to 17, 18, 19 years old, we are doing a lot of work to promote vaccination. But all along, we have been talking about one point, and that is basic education service or provision of education for our students. This is a basic right, and this should not be affected by whether a person or student is vaccinated or not. For those who have been vaccinated, well, we allow them to go back to school for non-academic activities in the afternoon. And besides, we are also thinking of, for example, students who would like to be taken care of in schools, they should also need to be vaccinated. So we will work hard in this regard. Secretary, please do not mute me because I need to chair the meeting. If you mute me, then it is difficult for me to do my job. I have written a message to you, but still you have not switched on my microphone. So I would decide when I would like to mute or unmute myself. Please do not turn off my mic. Next member, Mr. Chu Kwok-keung. Thank you, Chairman. I have 3 questions. In the past few months, when there is a lack of health protection measures and people can't contact CHP, well, if there are confirmed students in schools, then the schools will be asked to adopt a school-based approach, and eventually the number of days of school closure will be from 1 to 6 days. Actually, for the same situation, the approach or treatment varies a lot. I think the Bureau has the responsibility to communicate well with CHP. A lot of issues cannot be solved in a school-based approach. So when the Bureau revises the health protection measures, apart from communicating with CHP, will you communicate with the sector and gather comments on points of concern so that we know that under different circumstances, what should be the approach and the principles and what measures should be adopted. Number two, HKDSE will take place in April as scheduled. In order to make sure that the examination will take place in a safe environment, will the administration consider using high standard air ventilators in the exam venue? And will there be financial assistance for cleansing after examination? Finally, under the pandemic, the preschool classes in kindergartens have seen a lot of abortion rates. So private kindergartens are subject to the most impact. They are under big financial pressure. Some are prone to closing down. Apart from the anti-epidemic funds subsidy, will there be further support measures to help the kindergartens to ride out the difficulties? Will there be extra supply teacher subsidy for these kindergartens? Secretary, well, arrangement after class suspension, well, we have heard a lot from the sector because we are in close contact. As I answered the previous question, I said that now we are working with CHP to see whether there are clearer guidelines, because in the past, as we know, in the past 4 waves, the situation was different and the number was not big. At that time, based on every case, CHP would like to make decision based on the actual circumstances. But now, are we able to say for sure that each case will be considered separately? Or can we put in place some broad guidelines and approaches? We are now talking to them. Regarding DSE, we announced a few days ago that within the examination venue for core subjects, basically, students will go to their own schools for examination. And in the past, during the DSE duration, the examination venues are the responsibility of the Hong Kong EAA. And after the venues are used, after schooling restarts, well, the schools will pay for cleansing. So this is their normal expenditure. There is not the need to offer another amount for one-off cleansing after DSE because we are talking about the same students going back to the same school. For kindergartens within the kindergarten scheme, the amount of grants given is based on the number of registered students. So there isn't much change in terms of the grants. Regarding private kindergartens, well, as the name suggests, these are private operators or institutions. So all along, the government does not offer grants or subsidies to them. However, since there is anti-epidemic fund and other related subsidies, we will try to fight for them for the amount. Next, Mr. Chairman Kwong. Thank you, Chairman, Secretary. So schooling will resume soon on the 19th. Referring to CHP's latest information as of the day before yesterday, for 3-year-old to 11-year-old children, there are only 61.45% who have taken the first dose. For second dose, only 25.5%. And 15,000 12 to 19-year-old adolescents have not been vaccinated at all. Now, many parents and teachers said that they are worried that if students have not been fully vaccinated and if face-to-face class resumes, then there would be the situation similar to those in elderly care homes. There were 8,000 odd deaths under the pandemic, and most have not received vaccination. I have listened to some respiratory disease experts, and just now the Secretary also emphasized many times that you will consult different health experts. And you attach much importance to students' right to education. Of course, we understand that we want class to resume as soon as possible. Otherwise, parents and students will have difficult time. They are close to having mental health problems. So some students insist on not getting vaccination, and we don't want them to affect other vaccinated students to receive face-to-face schooling. So now my first point is, if students have got 2 doses, then they can go back to school for face-to-face class. For those who haven't been fully vaccinated, so just wait for them to be fully vaccinated. So in the interim period, they can take online lessons. I have consulted the respiratory disease experts. If students who have medical certificates could not get vaccination. Now, when vaccination takeout reaches 95%, then they can apply for face-to-face class. They can protect themselves. At the same time, all students and teachers can also be protected. Now, Vaccine Path covers students. This is not a solution out of the vacuum. So they are based on respiratory disease experts, and in the US and India, the same approach is taken. So Secretary, can this be considered so that students can be better protected? So parents and teachers don't need to be so worried. Thank you. Secretary, thank you, Chairman. We have heard the point. Recently, we have heard different voices from different sides. There are teachers and parents who are worried. They are worried that now that the vaccination rate is still so low, is it safe for school resumption? And some parents said that school should resume, otherwise there will be learning problems. So we need to strike a balance. Whether schooling should resume, we have to consider the overall pandemic. Recently, the pandemic seems to be waning. Yesterday, there were 2,700 odd confirmed cases. And in the coming days, on Friday, Saturday, and Sunday, we hope that all members of the Hong Kong public will take RAT for 3 consecutive days. And then we can identify the hidden cases. Then after that, we hope that the pandemic will be alleviated. Let's all participate in the process. And then we also consider overall student vaccination rate. That is another important factor. Now, at present, the vaccination rate is still 60-odd%, especially for 3-year to 11-year-old students. So for kindergartens and primary schools, well, we may not be able to have full-day class at the initial period. So we'll start from half-day school. And when vaccination rate is higher, we'll think of full-day schooling. However, for students who have already been vaccinated, we believe that they can also stay in school for the remaining half day. They can engage in physical activities and other non-academic activities. For whole day primary schools, well, sometimes we hope that in the afternoon they can get involved in more different types of activities. So this can help those who have been vaccinated so that they have more room to develop their other social lives and other aspects. So we hope that this can encourage more students to go for vaccination. Okay, Mr. Leung Hae, please. Thank you, Chairman and Secretary. First of all, I'd like to thank the administration and Hong Kong EAA for listening to the DAB's suggestion. That is, if DAB candidates are confirmed on the exam day, there should be a special examination arrangement. Now, if they are confirmed on the same day, they should contact the administration before 6:30 a.m. and then they should call the anti-epidemic taxis by phone. So I want to know that day, how many hotlines will you arrange and how many people will be there to man the calls, the hotlines? Usually when we call government hotlines, very often the lines are all occupied and we may have to queue up for 1 hour, for example. So that day, students have to get ready for the exam, and if they have to wait for 1 hour for their course to be taken, then they may miss the examination. This is not satisfactory. So will there be enough manpower that day? If there is not enough manpower to cope with the request, then can you consider the case of lost credit cards? So people can make a phone call and then they can input the ID card number or candidate number. Then there's not a need for someone to answer the call. So I just want to know the special arrangement of the hotline. Thank you. Secretary, please.
Of course, if you look at the overall design, we have isolation center where we can have them. So if we know in advance that you have the exam the next day, but you are not feeling well, or you already did the test and you have tested positive, you can enter the center right away. You don't need to wait for the next day. So we are talking about that morning, those who realize they have been infected that morning. In the morning, we ask them to notify the authority because we need to make arrangements for the exam papers or a supervisor. Secondly, we will make transportation arrangements. So when they make a phone call, they need to enter certain digits, but it's still not good enough. They need someone to pick up the call saying, I have received your request. You want to be admitted. We will now arrange transportation for you. In theory, 2 SMSs will be received. One is in relation to receiving the request and making transportation arrangements. Second, the taxi driver will contact them and tell them what time they will turn up to pick them up. We need something interactive because they also need to input the address, where to pick them up, around what time it's okay. So we need to talk about the details. We can't just rely on inputting information. At the moment, we are just guessing how many people will be needed for this exercise. It may be more than expected. So we'll try to reserve more manpower. We're still looking at the development of the pandemic if the infection figures continue to drop. But now 20,000 odd. Just before the exam, perhaps it will drop to 2 digits. So actually, we won't keep people waiting. We will try our best to reserve enough manpower to do this matter. In case on that day, something totally unexpected happens, then we'll have to deal with it like crisis handling. Next, Leung Yuk Wei. Thank you, Madam Chair. Another member talked about arrangements for resumption of classes. Because we are in the first wave, infectious rate is very high. What will be the guideline for close contacts? We urge the Bureau to tell us the details about the arrangements because everything needs time. We understand that you need to liaise with the Bureau for Food and Health. But I understand that many young parents are worried about resumption and they're also terrified with suspension of classes as well. You also talked about the FE and taxi arrangements, but what about exam venues? In case an outbreak has been identified on campus, do you have a plan B? More preparation can be done, more resources can be prepared, more power to supervise the students, for example. We also know that many grassroots families expect that when it comes to rapid tests or protective masks will become daily essentials. Do you have any plan to hand out such resources to the needy families? I know that there are different subsidies to schools. What about grassroots students? Will they get such support? And finally, in the paper, you have talked about some schools providing boarding facilities and special schools. But there was not much follow-up on vaccination arrangements and operational details. Can I get more insight into that, please? Mr. Yang? Well, first on the rapid test. Indeed, it is very common and there's plenty of supply. We are talking to health experts. If we use more of such tests, we offer better protection to school campuses. And if there are isolated infection cases, perhaps no need to suspend school right away. We are talking about that. We need massive amount of RATs. For example, if we are to administer the test every day or every other day, then we will, of course, think about more needy families. We'll think about how to take care of them. In the paper, for example, you see that for needy families and students, we are providing masks. So we will definitely consider it. As for special schools, we have already made arrangements to outreach vaccination services. We have brought some students to the hospital. For example, because students we are worried that they may have stronger side effects. We want to bring them to the doctor to have a look first, then get the vaccination. We have also made arrangements to send doctors to special schools to vaccinate the students. We've talked to the special school counselors. They are quite concerned about some weaker students. So we are talking about a new arrangement. If you are staying in the boarding school, well, this is not a kind of fundamental educational need. And you need to be vaccinated if you want to stay in the boarding school. Otherwise, to other students, you may pose certain risks. So we will continue to do it. I will answer other questions later on. Any follow-up? Chen Chong-Nei? Thank you, Madam Chair. First of all, thank you, Education Bureau, for accepting JP's suggestion about DSE exam arrangement. And now the Bureau has announced that for DSE, there will be special exam arrangements so that infected students or close contacts can still attend the exams. So thank you, Secretary and Permanent Secretary, for your effort. And secondly, I'm happy to hear from Mr. Young that they will consider a more frequent use of RATs. Originally, I was going to say many people in the school sector or students who have not yet received 2 vaccines, perhaps we can administer the RAT on a more frequent basis. And also for the more needy families, how to take care of them. I won't repeat them because the Secretary has already offered great details. There's another point of concern. Zio talked about this at the beginning. When students and teachers reach vaccination rates, which is satisfactory, and we can consider resumption of whole day face-to-face classes. Here, I have a question. The Bureau offer more details about the implementation. Are you going to allow everyone to participate, or are you going to start with the older students and then move on to the younger students? Or are you going to hand it over to the school management for them to decide on their own? On this question, I would like to ask for more insights from Mr. Young. Okay, perhaps I can offer more details. We will need to further our discussion with the school councils because it depends on feasibility. First, we are thinking about starting from the primary school after Easter holiday. Senior primary students can go back to school on a half-day basis, and then on the 3rd of May, the rest of primary school students can go back on a half-day basis. At the same time, for secondary schools, we'll start with senior classes and 1 grade for the kindergarten so that there's more time for people to adjust. We're all talking about half-day schooling here. 1 week later, all secondary students have resumed face-to-face class. And then another week goes by, around the 16th or 17th, for all the local schools, all the students will be attending half-day school. This school year, we have some new arrangements. If there is 70% of vaccination rate at secondary school, allow whole-day schooling. If it reaches 90%, or for the former case, half-day schooling, and if it reaches 90%, whole-day schooling. So for secondary schools, if the rate is 90%, we will allow whole-day schooling because we believe it is safer. But for primary school and kindergarten, we have to wait until resumption of schooling. To the middle of May, we'll have to look at the situation. For example, if there is any outbreak on campuses, or the development in the entire city, and then we'll think about primary schools and kindergartens when we can allow it. As I said, for those already vaccinated, we will allow these students, whether they are kindergarten or primary, to engage in non-academic activities on school campus. Parents can choose what they want to do. If they are truly worried, then just bring them home after half-day schooling. There will be some room for them to engage in music or sports activities. Next, Chen Huoyan. Mr. Young. What about striking a balance? Because some parents ask for continuation of suspension. Some ask for resumption. It's hard to choose. It may be self-reflecting. Sometimes in the morning press conference, someone will say the pandemic is coming to the end, it's still very serious, there will be no territory-wide infection, there will be a rebound. And on the other side, someone will say the 19th of April will be the best time to resume classes after the public holidays. Although you said it will be done in phases, we are worried there will be a rebound of infections after the holiday. Why don't you do territory-wide inspection first to ensure we are controlling the pandemic well? Isn't it too soon to decide when we still have thousands of cases? What about voluntary tests? If that actually succeeds, we won't need anything compulsory. So the policies are very self-conflicting. Secondly, I also want to say that we need to take reference of the figure. As parents and students, well, we don't know how many students in the class of my child have gotten 1 or 2 vaccinations. And yesterday, a professor, Lao Yulong, said at the moment, there are more than 30 serious children's infections, and 15 to 20 of them will die from the disease. So when you talk about resumption on January 27th, you decided to stop all the lessons when there were more than 100 cases. But now when we have thousands of cases, you're talking about resumption. So the indicators are very confusing. Yes, you can be vaccinated and then prevent serious cases and death, but you are not immune. You can still be infected. There could be long-term effects. So as parents, it's hard to decide. I want my children to go back to school, but when they go back, even when they are vaccinated, they may be infected, and that could be long-term effects. So I think the government needs to balance everything. If the government suddenly decides to have territory-wide tests, are you going to use two campuses and suddenly there will be different arrangements for the summer holiday.
Ms. Chen actually spelled out the difficulty that we face under the pandemic. On one hand, we have to take into consideration safety of the public. If you only consider from health point of view, then, well, it may be best for everything to suspend and to adopt the most stringent social distancing measures. That will be the safest. However, since end December, all along till now, it has been 3 months or so already. So when we look at the development of the pandemic, is it true that, well, for students, apart from considering their health, they also have their mental health concerns and their learning needs? It's difficult to strike a balance between the two, but we still have to do so. In the school environment, it is easier for us to control safety, and at the same time, schooling or attending class is a more static activity, especially when masks are worn. It is safer than other activities. In kindergartens and primary schools where vaccination rate is lower, we start from half-day schooling. So we want to avoid them having to take off their mask to have lunch. So we can just try our best to strike a balance. And it is not suitable. Well, just now, Ms. Chen talked about 100 odd cases. For those cases, we are not only looking at the number, we have to see whether the number is going up or down. We have to compare the vaccination rate at that time and now. Besides, we need to look at the control of pandemic in the society. And our views concerning the pandemic are different now. Besides, so if there is a short period of time of suspension, it is acceptable. But now that class has been suspended for such a long time, it is different. So I agree with Ms. Chen. As parents and as government, we need to strike a balance. I want people to be safe and happy. And we need to listen to many views in order to make the best decision. And follow up. I will follow up later. Okay. Mr. Leung Chi-wing. Mr. Leung Chi-wing, please. Can his microphone be switched on? I'm sorry, I was just speaking at another meeting. Okay, Mr. Luk Hon Man then. Thank you, Chairman. Secretary, greetings. I want to commend the Education Bureau again because early summer vacation for schools, objectively speaking, is helpful to reducing number of people in the community, and it is helpful to reduce the number of confirmed cases and infections. So it is one of the most critical solutions. I want to ask the Bureau. Now, Secretary, on 23rd March, announcement was made that after resumption of class, basically classes will still be half day only. In order to resume whole day class, there are two main conditions. First, all teaching staff members have to get the second dose of vaccine. And besides, students who have the second dose should account for 90% of the total. Some time ago, some international schools met with the CE and an email was sent to parents concerning international school half day or versus whole day schooling. Special arrangement can be made. For local schools, when we are talking about students, young people, and human beings, the same. There is the requirement about 90% vaccination rate. And some school principals said that the arrangement is confusing and not fair. So concerning the 90% vaccination rate requirement, I have another question. How do you derive this 90% vaccination rate? Many teachers and school principals would like to enhance the effectiveness of education. So they'd like to have face-to-face whole day class. So recovery certificate, will it be counted? And what about medical certificates for not being suitable for vaccination? Do those count? This Friday, that is yesterday, for 3 consecutive days, the government will administer the 3-day RATs, of course, on a voluntary basis. I would like to appeal to the public to do RAT for DSE candidates. Before they sit examination, they need to take RAT. So in order to help Hong Kong, can the administration consider providing enough RAT kits for schools so that students and teachers can adopt the same standard as in care homes, like 1 test per 3 days, so that the number of infected cases can go back to the safe level. So early detection, early isolation. Now, the CE said that 100 million RAT kits had been made available. So are we able to achieve the voluntary RAT arrangements? Thank you, Secretary. Well, in the community and also in the education sector, there may be misunderstandings. For international schools, there are some arrangements of which we offer special consideration because the curriculum is different and the curriculum has to dovetail with that overseas. For example, if students need to take public examination, then the work that needs to be done within a certain period of time has to be considered. Otherwise, some students will not be able to take the overseas public exams. And then the government and the Hong Kong EAA can make adjustments to Hong Kong DSE. The situation is different for international schools. So we have to consider their specific needs. As regards the schooling or class arrangements, in principle, as member said, we are all human beings. And so in principle, the requirements are the same. However, because when it comes to international schools, we would like to offer them more flexibility to see what arrangements can be put in place so that those students will not be affected too much in terms of their learning. So we would like to consider more flexibility for this reason. So now, for primary schools, we do not talk about the 90% because in mid-May, we will review the situation and see what should be done. For secondary schools, we say 90%. And in principle, for international schools, we also have this consideration. But we will consider the arrangement for international schools. In the past, not all international schools could conduct whole-day schooling. For RATs, now in the market, there is quite abundant supply. And so far, we do not see any shortage. The government has people responsible for monitoring the supply in the market. Right. Chairman, the Secretary has not answered one of my questions. Can there be 1 test per 3 days for schools so that we can identify cases earlier and there can be early isolation? Secretary, that question was not answered. Yes, let me briefly respond. We are talking to CHP now. Well, perhaps the test will be more frequent than 1 test per 3 days. That means you will study, you will do some research according to this direction. Yes? So ASAP, please. Mr. Mchapak, thank you, Chairman and Secretary. Now, resumption of class for students is a very important measure. However, concerning resumption of class arrangements, I hope that the Education Bureau can be faster. So specific arrangements should be made with schools as soon as possible. For a long period of time, students attend online classes at home. This is not satisfactory. Many parents and many members of the education sector have shown concern over that. So resumption of class, we hope to achieve that with some good conditions. Concerning vaccination rates among students, well, that is low. One of the reasons may be related to parents, schools, and the Education Bureau. Can you offer more explanation from experts to alleviate or to allay parents' concerns. Parents would like to protect their children, so they have a kind of resistance. So I think there should be some scientific explanation about vaccination. That's one thing. Secondly, for a long period of time, students attended online class at home. This is really unsatisfactory. The learning is very mixed in effects. There may be some self-motivated children, but still they are not in class. They are not in physical class. So the situation is worrying. Students' academic achievements are seriously affected. So apart from the measures set out by the Bureau and also the hardware, for example, computers, network assistance, and so on, in the future, are you going to offer more assistance and support to schools and parents so that they can catch up on what their children have lagged behind? Besides, for the Education Bureau, so far it seems that the Bureau is not having full grasp about students' infection. If you know more about students' infection, then you will have some measures to tackle the situation. Okay, Secretary. Well, I will ask the Permanent Secretary to comment on online classes regarding enhancement of parent education. All along, we have been doing it. We will do more. And we are also working with PTAs to step up publicity. Besides, regarding infection number among students, well, based on age group, we have got some information and figures from the Department of Health. So we are in the know, and we are in close contact with health experts to see what kind of anti-epidemic work should be done. So Permanent Secretary, please. Yes, thank you, Chairman, and thank you, Mr. Ng. Regarding how we support children in learning and teaching, first of all, as we stated in the paper, in terms of hardware and software and resources, especially learning and teaching resources, we are doing our work on all three aspects. So for example, hardware, there are computers and also portable devices. For software, for example, equipment for internet access. And then in terms of learning and teaching support and assistance, the Education Bureau and also e-learning resources, they are available on our website. So they are made available for schools and parents to choose from so that during class suspension or during holiday or after class resumption, there can be more diversified and enriched teaching resources so that they can make good use of the resources and catch up with their progress. Well, I don't think this is satisfactory. Are there some measures to help the schools to catch up so that the missed number of hours can be remedied? Okay, this is a very precise question. So do you have a timetable on the number of hours fallen short? Well, Chairman, learning is a long-term process. A child from primary school to secondary school, there won't be the question that there is 1 year that was missed and so they could not catch up. Now, if you ask the education sector, in the future, if things are stable, then they should be able to catch up. Things will be difficult from one stage to another. For example, from primary school to secondary school, there may be difficulties in the transitional period. And in case of public exam, it may be difficult to catch up in the coming few years. For S1 students, they still have like 5 or 6 years to stay in school, so they will be able to catch up. So we really need to look at how arrangements can be made in school. So if you only refer to some hard numbers, I think there are difficulties among different students. And if you try to catch up things that you have missed within 1 year, then that may not be very desirable. right, Secretary, I think we need to be very clear. Even if you can't catch up with the number of hours, you still need to do something. I am teaching. I know that both students and parents are very anxious. You need to understand that. They may not be able to understand your very abstract point about catching up. You need to be very clear. So in the future, the number of lessons that you may add back, for example, I add 2 more hours every week so that you can catch up. That's what I do. So you need to be specific.
Thank you, Madam Chair. You can hear me right. First of all, I want to thank Mr. Young. I know DSE resumption arrangements created a lot of pressure on them because a lot of workload, and you need to update many guidelines facing this very serious wave of infection. The education sector prefers resumption, so do the parents, but they don't want to resume face-to-face classes so soon. Previously, 200 cases led to suspension of classes. So when we are still having 4 digits for infection numbers, why are you resuming the class? Where do you draw the line? How do you draw the line? What are the principles? Many people have the same doubt. Secondly, when it comes to various level of schooling, we are talking about 2.5 days of substitution lesson expenses. But once they are affected, they are sick for 7 days or longer. So they are using up the expenses that goes to other substitute teachers. So I think in terms of the operations, the schools are looking for more details. When it comes to guidelines, we urge the administration to focus on secondary school, primary school, and kindergarten needs and special schools to offer different sets of guidelines. For example, we are talking about private schools, full day, half day, special schools also have boarding and non-boarding sections. So what are the guidelines for all these different types, especially for the boarding sector? Under the education department, they also tied to the bureau. So you need a lot of days of the order too. Infected people who are boarders, they will be sent to isolation facilities. But that arrangement may not cover the boarding section of special schools. So can you tell us more information about that? And what about the DSE arrangements? Please clarify on the arrangements and inform the students of the arrangement because they're very concerned, especially since we have been talking about compulsory tests. If you receive the compulsory test request, what are the arrangements for entering the facilities? And what about the close contacts? Many people are very concerned about these matters. Mr. Young, please. For DSE, we have already announced very clear arrangements. I understand that the authority will meet with headmasters. And for CTN, for people who have visited certain, ask people to do PCR test within a number of days. Let's stop the clock first.
So now, can you hear me? Can you hear me now? Can you hear me now?
Yes, we can hear you now. So, Mr. Young, can you hear me now? It's
So
okay
can you
now.
hear me now? Yes, okay now. Okay now. For Hong Kong DSE, some time ago, we made an announcement, and overall speaking, the situation is clear. So perhaps there is one thing that that was not mentioned, and today, in fact, we will.
So within 2 to 3 days after visiting the place, you need to take the test. These cases, because they are not close contacts, they are not confirmed cases, and they can freely roam around the community. For such cases, they can go to the exam venue, as long as before the exam they do RAT and obtain negative result. They can go to the venue to take the exam. We will inform the schools. As for the guidelines, we will try to make them as clear as possible. Many things are in common, whether you're a private school, kindergarten, or subsidized school. The hygienic arrangement is the same. If you are a private or public school, the hygienic requirements are the same. So for special schools, we tell them there will be more flexible arrangements. In theory, schools have the money. No one has told us they have spent all the money. And we don't believe we need many teachers. Otherwise, we won't have the conditions necessary to use the classes. Back to the first question, should we resume face-to-face classes? We've talked about this many times. It's very difficult to strike a balance. It's easy to say, just have Zoom classes. Is that the best for the students? Many people have said online teaching is not that great to students. So all we can do is try our best to provide the safest environment to resume face-to-face as soon as possible. You need to queue up for the second round, okay? You got most of the time already. You have to queue up again. Next is me. First of all, please be concise in answering my questions. Have you noticed some news I have saying that there are some figures involving children who passed away? 3 out of 4 were healthy. Only 1 had certain health conditions. I don't know how you define health conditions or diseases. For recent cases, many high pressure cases have been classified as such. Whether they have certain health conditions or not, they are our treasure. We can't lose any children. Even 1 passing away is a great loss. So let's not take the chances. We made announcements that there will be resumption on the 19th of April for face-to-face classes. Even if you phase it out or comprehensively half-day schooling, 19th of April, if they take the first vaccination, we already missed that chance. Today's the 7th. They can't make it. So the current rate is 60%, and for the first shot, many experts already said that it's not enough, it's safe. So some parents ask for face-to-face lesson very soon. Do they realize it's risking their children's lives? I've heard from many parents. They want to send kids to kindergartens, back to school. That's under normal circumstances. But if the school campus is dangerous, you have to reconsider. You can't just say in the ideal situation, well, 60% is definitely not ideal. What about 70, 80? And it is not yet sufficient. Just the first vaccination, there's a little bit of immunity only, and you ask them to go back to school and they're kindergarten students. and primary school students, then I'm very concerned. I don't support this at all. You have to calculate it backward. 30th of April, deadline for the first vaccination. Then on the 15th of April is we draw the line. This is risky. And what about Dr. Lecture Yu? Ordinary masks are no longer sufficient. Are we going to distribute KN94 masks to all the students? According to some teachers, the guidelines are outdated. They refer to 15 infection cases. We don't know what will happen on the 19th of April. If you can't really do it, don't give any false hope. Otherwise, students will think face-to-face classes will resume on the 19th this month, and if anything happens, they will blame it on you because you need to tell them how high the risks are. So on the record, I do not support resumption of face-to-face classes on the 19th of April. Otherwise, you have to show all the blame. Parents will say, you know more. But there are so much risk, then you are to blame. So I do not support resumption of classes unless we reach vaccination rate at 90%. The risk coefficient is too high. Ms. Yo? Well, back to striking a balance and risk. If you want me to ensure there is no infection, I can't. I didn't talk about infection. I'm talking about deaths. Number of fatalities. When you get sick, there are so many factors driving different directions of development. Let's talk about infection first. Even if it's 100% vaccination rate, we can't guarantee there is no infection. We are just saying after the vaccination, we will reduce the number of deaths, reduce the risk of serious cases. There will still be risk. If you want anyone to ensure there is no risk, that is very difficult. The problem is, I'm sorry, Mr. Young. I'm sorry. I did not ask you to ensure there is no risk. I'm saying you have to ensure 90% vaccination rate, including small children. Can you do it? If you can't, then wait till the vaccination exercise is completed. This bureau is saying 30th of April, the other one is saying we should do it sooner. There's a lack of coordination, but your bureau should shoulder the responsibility. Wait until the vaccination rate is that high. Then you allow face-to-face lesson again. That is the risk coefficient. Even the experts will believe it is more reasonable. We're not yet there. 90% plus 14 days. I'm not saying zero risk, but generally accepted risk and no complaints from the parents. That's what I want. I can only say when we look at risk and what's more important, everyone will come up with different ideas. Who would accept a certain risk level? Who wouldn't? It also depends. How important is resumption of classes and face-to-face classes? There are different views. The government needs to make the decision. And of course, we are aware of the difficulty and we have to come up with a decision at the end, no matter what. We understand what you are saying. On behalf of, if you are also presenting views as the whole panel, we have to go back and reconsider. So for the sake of the children, well, I have done my best. I think it needs to go on the record, okay? I'm not talking about infections. Many people are worried about long-term effects. If you lose your life, you are dead. It's gone. So it will create huge impacts if we're not yet well prepared. Next is Mr. Tik Chi Yun. Thank you, Madam Chair. I understand the administration or Mr. Young wants to resume classes and things go back to normal. I think that is the expectation of everyone.
Of course, today the secretary has heard all the points clearly. Maybe there is still some worry. So how can we improve the work? I think that is more meaningful than being worried. Well, if you say that schooling should be deferred, then there would be a lot of feedback among the public. Now, concerning vaccination, I hope that the secretary will do more work. Now, we always talk about precise work right now, precise poverty alleviation, precise answer, precise vaccination. I think that should be given more thought. Let me share my experience. In early February in LegCo, we had a meeting and we asked the Labor and Welfare Bureau to vaccinate elderly in elderly care home. And at that time, many family members were against vaccination because they are worried about risk. And the outcome is very disappointing and saddening because many elders suffered from severe cases or even passed away because of no vaccination. So vaccination is really important. Just now, the secretary said that publicity should be done via PTAs. I think publicity is too weak. I think you should mobilize community, school, and social workers' resources to push for vaccination. I think parents are the critical points. If they understand that vaccination is helpful to their children, then I think more work should be done. Take special schools as an example and special school hostels. Now, there is outreach vaccination at elderly care home. Can we do that in special schools as well? Some SENs cannot go to community facilities to take vaccination. So can these students be accompanied by teachers to get vaccination? I think there are many possible ways. At the beginning, there were difficulties with the elderly, and now almost all the elders who can take vaccination have been vaccinated. So is this a good solution as well? And concerning isolation facilities, well, some special school staff said that at present, the arrangement is a bit confusing. So can we discuss with them in the hostels or in schools if there are infections? Then can there be more detailed isolation approaches? About special schools, their environment is slightly different from normal schools. And as member just said, can some flexibility be provided? Let's say your timing is 19th April. So can you discuss with the officers there so that there won't be broad-brushed approach? There can be gradual or step-by-step interview for special schools. I think most parents would like their children to go back to school as soon as possible. Secretary, Chairman, we are very concerned about children's health. We definitely don't want to see, no matter whether we are talking about special schools or normal schools, we don't want to see children be infected. So we have done the utmost to encourage schools to arrange the students to be vaccinated. So in the past, you can see that we have done a lot. And for special schools, we have made arrangements to go to special schools and their hostels to vaccinate the students. So we will continue to do such work. Concerning class resumption, we discuss with special schools separately because for different types and different situations, we will give different consideration so that we can tailor the approach based on their needs. And concerning hostels, if there are infected cases, how will isolation be done? We are talking to Hospital Authority and Department of Health. Mr. Siu Ka-fai, please. Mr. Dick Chi-yun, if you would like to speak, please press the button for the second round. I want to exercise my discretion to extend the meeting for 15 minutes. So I will first allow all members for the first round to ask questions first. I will try my best to allow questions for the second round. Mr. Siu Ka-fai, please. Thank you, Chairman. Chairman, I agree with you. If vaccination rate doesn't reach 90%, and if class is resumed, many parents have called me. They are worried, especially those kindergarten parents. Now, Secretary, I want to say this. In the past, well, under the fifth wave, the elders are a very severe lesson learned. We have to ensure public safety, especially the elderly and the children. Many children, especially small children in kindergartens, they have not been vaccinated. And now you want to meet the timetable of 19th of April. You want to resume class at that time. If there is any problem, I believe this time no one can forgive the administration because there was the experience, the lesson learned already. Well, in the past 2 months, everything was suspended, but there was still online class. I think it still works. And right now, you want to resume class at such an early date. Many small children have not been vaccinated. People are so worried. Now, Chairman, I'm not a member of this panel, but I need to thank you. I want to express my point. The administration really should double think. My second point is, well, perhaps this is not related to you, but when class is resumed, if many children are infected, then they may need to be isolated. Can their parents accompany them? Some time ago, the hospital authority said no, so many people are worried. And many foreigners, because of this policy, took airplane and left Hong Kong. So many members of the public share the same concern. Yesterday, the requirement was relaxed in Shanghai. So if parents willingly accompany their children, they are allowed to do so. So I hope that this policy can be relaxed so that parents can have an ease of mind. Yes, Secretary, please. Regarding vaccination rate, the chairman just commented. I have heard you. I will go back to consider. So the chairman and member are saying that concerning vaccination rate of a certain age group, if it can't reach a certain rate, so schooling should not be resumed. Your comments are very clear. We will go back to consider your point after this meeting. Regarding whether parents can accompany children during isolation, well, isolation facilities are not managed by Education Bureau. We understand parents' worry. And I know that the department in charge knows about that. And recently, there was some change. I believe there would be adjustments based on the actual circumstances. Secretary, I want to continue. Regarding vaccination rate, so there was only 20% vaccination rate for the second dose. Is it because some parents are not willing to get vaccination? Why such a low vaccination rate? Yes, Chairman, a simple answer. For those above 3 years old, well, we started after February for these children to be allowed to be vaccinated. So the time frame is short. So that's why the vaccination rate for the second dose is so low, because they have not reached the timing for second dose. So that's why you should not ask kindergartens to resume class so early. Many parents are worried. Thank you, Chairman. Yes, I've heard your point. Thank you. Okay. Reverend Kun, and then Mr. Leung Chi-wing. Reverend Kun, please. Chairman, thank you. Well, some time ago, I had some views. I shared my views with colleagues, and I had checked with school principals. And recently, I had the opportunity to take a better look. I understand the Education Bureau has difficulty. Now, for online classes, for ordinary households, there may not be difficulty, but for grassroots families, well, they had a lot of hard time. The living area is really small and they may have 2 children. So it is not possible to have long time online class. Children are crowded in an area of 100 square feet. I have asked primary schools and kindergartens, and some households have very difficult living environment. They are in the grassroots level, and their expectation is very different. They hope to resume class as soon as possible so that their children have better environments to learn. I understand the Bureau's difficulties. Now, as colleagues know, we all know what is the safest. However, I want to tell you that the school sponsoring bodies and school principals also face much difficulty. So I understand it's difficult to strike a balance, but you really need to think. Some said that perhaps a hybrid model can be considered. Some students can be allowed to go back to school. This may be difficult for schools, but I hope you will understand the issues or the concerns about grassroots households. Any response from the Secretary? Well, we have heard so much today. I think we all understand. Safety is one thing, and resumption of class is another aspiration. So how can we strike a balance? So regarding the risk and also the benefits, how can we strike a balance? Different people have different views, but today, well, Chairman, you have made a very clear point. So we need to go back to consider. I think what you said represents some people's views. Okay, Mr. Holden Chow. Thank you, Chairman. First of all, well, Secretary, in fact, I had approached you many times to talk about vaccination after class resumption. Today, you said that a balance should be struck. Well, I think the same old point here. I think this point of balance can be reached as long as you are determined enough and ask the schools to put in place a measure. First of all, vaccinated children can go back to school. For those who have not been vaccinated yet, will have to stay at home and take online class. If you adopt this very clear approach on mandatory basis, then a lot of problems can be solved. Just now, I heard what Reverend Kuhn said. Actually, what Reverend Kuhn just said is also the feedback from many grassroots families. Many grassroots families have very poor living conditions. Besides, both parents need to go out to work. And in the past, when there was schooling, well, the children were taken care of by the schools, but now they take online classes at home. So it is even more difficult to take care of the children. For many grassroots families, they have the need for classes to be resumed, to take care of their children. They have strong need for that. So I think, well, vaccination rate needs to be high, as many colleagues said. I personally think that in order to solve this problem, to protect people's safety, first, students should only be allowed to go back to school after vaccination. If they have not been vaccinated, they should stay at home for online class. If for different reasons they are not vaccinated yet, well, as we said, we need to urge the government to try their very best to make available vaccination facilities. So if people want to go for vaccination, they would be able to get it. But if there are people who don't need to be vaccinated, then sorry, there should be very clear administrative measures that they cannot go back to school for face-to-face class. So first of all, the children can be protected. So these unvaccinated children will not go back to school and they will not be infected. And for the vaccinated students, well, parents will not need to worry because only vaccinated children can go back to school. So I hope the Secretary can make this decision. I think the schools will have hard time, but I hope we should ride out the difficulty together and adopt this approach. Otherwise, I'm worried that if we stay in the middle of the line, then the problem can't be solved. So if this administrative measure is taken, then I think it will be a good solution. Perhaps you can introduce a pilot scheme in some schools. That's my view. Thank you, Chairman. Okay. Secretary, vaccine pass. Okay. Now, if you talk about online class and face-to-face class at the same time, this is very difficult to schools.
If you have to take care of the students and online teaching is very difficult, but we can talk to the school sector again. I'll meet with them tomorrow and I will pass the message along. We have a fundamental principle. Vaccination should not be a precondition for receiving education. We still feel the same way today. We haven't seen any such precondition around the world. All right, finally, Wen Shiwing. And there will be a second round. And I have told you for a very long time, 2 years now, at the university level, I've offered hybrid lessons. You have to accept it. You just learn how to do it, and it's possible. If I can learn it, all teachers can learn it. I'm sure it's not difficult. All right, Wen Shiwing. Thank you. I agree with you, Madam Chair. Teachers should be able to learn IT very easily to teach. Like in 2020 or 2019, after the outbreak, many teachers have already started teaching online. So I want to ask the secretary, we need to balance interests of various sectors. I don't think that's the key. We need to resolve the issues. Parents feel that their children have already received 2 or even 3 vaccinations, but physical classes are still suspended. Some teachers do not allow the students to take the vaccination, and therefore forcing the schools not being able to resume physical classes. In the past 2 years, I've returned to university to learn. We have this combined or mixed mode of teaching. If you haven't taken your shots, stay home, take online lessons, otherwise go back to school. Many parents want this to solve the problem. And then what about the schools? Do they have the resources to make this happen? Mixed or combined mode, because they need extra manpower. Can the Bureau offer more resources to help them so that we can realize such combined mode of teaching, offer more training to the teachers, perhaps? Thirdly, well, during SARS, we adopted the strategy of washing our hands. When you enter the campus, you have to take a body temperature. So in the future, we can ask this self-test among students. If they're okay, go to school, otherwise stay at home. Use the mixed or combined mode to handle it. Perhaps we will be able to resolve the problem. Students can go back to school and learn in different modes. Are we going to use a health code? The mainland practice is very good. Where you have gone to, you will see a different color on your code. So perhaps you can talk to the innovation arm of the government so that we can have dynamic zero out for the infection figures. Secretary, a mixed or combined mode is easier at the university level if you're talking about primary school. So the teacher's teaching in class and she will have to pay extra attention. That's hard to do. That's the fact. I'm not saying it's not possible, but perhaps not feasible for everyone because there are quite a number of teachers involved. We may need to offer more training to them. So that is going to need time, as I said just now. We can talk to the school sector about this and see if they think it is feasible. If it is, we're willing to try it. We're willing to do it. As for the health code suggestion, it is not just about education or schools. We're talking about the same group of students and teachers in one school, where they have been, what they have done. If you talk about the health code, it is about the entire society. And we urge students to do self-test every morning. Well, I already answered that earlier. We are considering that as one option. Next, second round, I will read out your names. Tan Hoyan, myself, Xun Dong, Zhang Mengong, Colin Lai. 2 minutes each. Perhaps to play safe, I will extend the meeting by another 15 minutes so as to allow the second round to be complete. Chen Hoyan first. Well, thank you. We all understand it's hard to strike a balance, but we have this common goal to protect our children and students, especially vaccination rate between the age of 3 and 12 is below 70%. Are we certain that the 19th of this month will be the first day of resumption? We have a mechanism, even for airplanes to resume flying. When do we stop the classes? When do we resume the classes? So in the future, perhaps we need to think about this mechanism. We need to consider the overall infection figures, vaccination rate. In the past, when we have flu, we also have clear guidelines. So we need something like that for class resumption. If people are willing to do the rapid test first before you go to work, one line is you can go to work safely. Or if you go back to school, we should do the same. So we have this vaccination pass. We need something like a QR code or health code so that we can ensure safety for everyone, free from infections. Mr. Yang, well, we can use more of the rapid test so that people have more confidence in going back to school. As for the circuit breaker idea, yes, we will think about that. Now it's my turn. If we can resume classes or work and the economic resources, we're willing to offer you more resources. You have talked about increasing resources, you need the rapid test, and so forth. Digital reconstruction post-pandemic, we need to cover all the schools. We're still in the middle of the pandemic. The vaccination is not just about the date of the vaccination, but plus 14 days afterwards. So we urge you, today is the 7th. If you do it tomorrow, plus 12 days, it means 22nd of April. One shot is artificial. You cannot assume immunity is fake. You need to add 14 days. So in the university, we feel very safe because everyone has to be vaccinated. Well, you can choose to learn online because it is about mass interest. If you're willing to take a vaccination, you can have physical classes. So spend more time and resources to train up teachers on this combined remote. I spent 2 weeks to learn it, but it's possible. So when it comes to digital reconstruction, we need to make it very comprehensive. A sixth wave is coming, some say. They are worried about loose restrictions for resumption of classes. They are saying that the sixth wave will come from kindergartens and primary schools. Especially worrying is the fact that some students are not yet vaccinated. So why not go ahead with a combined mode so that those vaccinated, they can go back to school face to face, the rest can learn online. You are not taking away the chances of receiving education, but we need to balance public health and safety on school campuses. That is a truly responsible and committed decision. I urge Mr. Young to listen to my views. We need to urge them to get the vaccinations. Tomorrow is already the 8th. They need to add 14 days to make the vaccination count. Okay, Mr. Young, any response? I have heard you loud and clear. We will give serious consideration. Next, Xun Dong. Thank you, Madam Chair. Two things. First, I support your suggestion. Actually, for the 3-year-olds to 11-year-olds, I'm very concerned. We can see this is the weakest link. There's no reason to place them on the forefront of resumption of classes. At the beginning of the wave, we did not take action to deal with the weakest link, which was the elderly homes, and bad things happened. I believe we need to postpone the resumption date, even for 1 whole month. You need to arrange vaccination for children aged between 3 and 11. That's the first point. Second point, I think we don't need to have cross-the-board resumption. I support what you just said. Around the world, yeah, no one is using this vaccination rate as a pretext for receiving education. I don't support that because we have the highest death rate around the world. China also said that human lives is the most important. So let's do it on the 19th of May. If they satisfy the vaccination rate, they can enjoy resumption. So I believe there are many options. I support Madam Chair. I am teaching under this hybrid mode. There's no problem. Okay, just to voice things. Mr. Young, yes, noted. Chairman Kwong. Madam Chair, Secretary. The previous two members have talked about something that I also mentioned earlier. It's feasible in universities. I also want to talk about ventilation, which can offer better protection to our students. I've looked at all the details of the document, relying on my conscience and science. We have suffered from the pandemic for over 2 years, and things have been done very well already. If you look at elderly homes, everything just collapsed. So compared to what they have done, you are doing very well. So keep working on this. For ventilation, I noticed that in your document, directly subsidized schools, you offer some one-off grant to improve ventilation systems. But you are limiting that grant to only 3 types of schools. What about government schools and subsidized schools elsewhere? Are they receiving other grants? School campus optimization on ventilation system is very useful for other purposes too. Are you going to offer some air cleansing devices, medical grade devices, so that face-to-face classes can be safer? Government schools and subsidized schools, or the renovation was the government's duty. So for these two types, we have already started a rather large scale inspection. We've gone to every school to look at the classrooms, the halls, and special rooms in terms of their ventilation. And then we will adopt appropriate measures, renovation, repair, or addition of devices to make the ventilation system up to standard. For other directly subsidized schools or kindergartens, they have all along been responsible for doing their own maintenance work, who offered them from grant. Those subsidized by the government, they have to do something with the ventilation system to bring it up to standard. Finally, calling line. Madam Chair, I want to follow up on my first question. Some members have talked about vaccination rate and resumption of classes, where the criteria, what the criteria are. Some would say 70% is needed, but now we're talking about 60% and you're already offering resumption. So what is the criteria? Where's the standard? In the past 100 cases, you wanted to move all the lessons online, but today we have more than 1,000 and you're talking about resumption. You need to clarify the guidelines. We're facing a sixth wave. We need to be prepared. Under what circumstances should we tell the schools and the teachers? If this happens, this is what we will do. So, Mr. Young, can you be more clear? And together with the Department of Health, liaise with them and think about the situation. Secondly, it is about special schools or the boarding schools. Can you be more flexible, especially resumption arrangements? I really hope that you will target students returning to the campuses. Under different circumstances, there will be flexible arrangements instead of drawing the line according to the age bracket. Some flexibility, please. Mr. Young, for special schools, yes, it is flexible. We will talk to them one by one. For boarding schools, they haven't stopped operations. Despite the holiday, many boarding schools are still running. We have one extra request: vaccination across the board. We talked about suspension and then resumption conditions and the criteria. 70% in the past, we were talking about whole day schooling resumption. Like then, all schools were doing half day. If vaccination rate is high, we allow whole day. At the moment, we are considering whether we allow half day first. Thank you very much, Secretary, for coming to this special meeting, and Mr. Young is very sincere in answering our questions. So thank you very much. We've been discussing for nearly 2 hours. I want to make a suggestion. On the 19th of April, please don't make it a hard deadline. For those who have teaching experience, we're giving you a way out. If you don't want to make it compulsory to get vaccinated, you can refer to some overseas experience or practices. For example, Singapore, you have to pay for yourself if you don't get vaccinated. So you can make reference. But as educators, we have to focus on education. If you are also working with other bureaus, if you set the deadline for first vaccination on the 30th of April, you need to add another 14 days. Under such circumstances, why not buy time to train up the teachers? We are willing to allocate funds to you because the sixth wave is coming. We just don't want to see such huge sacrifices, especially not in schools, right? The combined mode is a way out. You need to train the teachers. So for teaching's sake, I learned everything. So as long as you are determined, there's a way we should ask for these 2 vaccinations. Safe environment, face-to-face class. If there are individual reasons for parents not allowing vaccination for the children, learn online. People are afraid of losing out or lagging behind. They will get vaccinated at the end. So only if there are medical reasons, we allow them to learn online so that we can better protect everyone with a higher level of immunity. That is our observation. So we want to urge everyone who is watching or listening, or the parents, please bring your child to get vaccinated as soon as possible. And you have to need, you need to wait for 14 days.
So Mr. Dick Chi-yun, he would like to speak, so I will let you speak. I would let you finish your point. Yes. A point of procedures. Just now, Chairman, you made a conclusion. I understand that that is your opinion. That doesn't represent the panel. We have not reached that consensus. I hope that on the 19th, that would be the necessary conditions to resume class. But as many colleagues said, well, I agree with them, especially on expedite vaccination. I understand that what you said, Chairman, is your personal opinion. Yes, it's my personal opinion and it's my observation. And the majority of members today had expressed some views, and we should have a majority view when we write the minutes, where we will state one member, well, you had said clearly that you would like to resume face-to-face class on 19th of April. You can clarify yourself, or do you want a higher vaccination rate before resuming class? This point is important. Today we have this meeting. We want to say whether the deadline should be 19th of April. And just now many colleagues are very concerned about this. So we will record this point in the minutes. And perhaps different members have different views, but basically the majority view is stated above, not only my personal opinion. So the majority view is the observation that I stated just now. And it is an observation. We have not gone through voting though, but many members have expressed this point. We want to see whether there is a safer way. If you want to resume face-to-face class on 19th April, then vaccination should be expedited as soon as possible. Or perhaps we should defer the deadline so that more parents will go for vaccination, and we should meet the 90% requirement. I think many members have expressed this very clear point on this. We will say in the minutes that, for example, a member, you, for example, have expressed some of the points, and we have heard different members stating different views. Those will be minuted. And I'm sure the secretary has heard all the points very clearly, okay? So today, we can conclude our discussion here. Thank you very much for staying till now. Thank you very much.